An energetic dad and granddad who was desperate to be there as his grandchildren grew up. But Wayne's family say missed opportunities to diagnose his cancer led to his death before he'd even received any treatment. He was just 61 years old.
It was a cruel way to go. And as he turned around and said to us all, he said he wouldn't let his dog suffer the way that he suffered. And he couldn't understand and get his head around why in this 2026 that you would have to suffer the way that he suffered.
The UK lags behind other countries for cancer survival rates. Just 70% of people in England start cancer treatment within 2 months. The target is 85%, but that hasn't been met for more than a decade. Today's National Cancer Plan pledges to meet that target in 3 years. And it says by 2035, 3/4 of patients will survive cancer for at least 5 years. And every patient is promised a personalised care plan covering mental health, diet and employment support.
The NHS is already struggling with millions on waiting lists, patients in corridors. How are you going to deliver this?
We've got a fully funded plan.
The Lib Dems say it's not funded, and the King's Fund say we're waiting to hear how it's going to be funded.
Well, it's a fully funded plan. For the next 3 years, we've got the money in the spending review. Beyond that, of course, we're going to need to make sure that government continues to invest in the plan. And of course, it needs to go with modernisation. We are beginning to see progress in the right direction in the NHS.
The government says investment in AI and robotic surgery like this at Guy's Hospital will improve diagnosis. Here at the Royal Free Hospital in London, they've made huge improvements to their cancer waiting times, but can others follow?
A national cancer plan has been years in the making, and while many welcome finally having a long-term strategy, there are doubts about whether the NHS in England can actually meet these targets and deliver on transforming cancer treatment and survival rates.
The NHS is under pressure and more investment will be needed in people, in modern equipment. Cancer patients will judge this plan on whether they are seeing reduced cancer waiting times, early diagnosis and spending more time with their loved ones.
Wayne had just 52 days between his diagnosis and his death. His loved ones hope this plan will mean fewer families are devastated like theirs. Rebecca Barry, ITV News.